Have you ever wondered how a microscopic organism like the coronavirus could bring the entire world to a standstill? It's a question that has puzzled many of us, but to understand the magnitude, we need to look at the sheer scale of the impact. First off, let's talk numbers. The coronavirus pandemic has affected millions of people globally. Countless individuals have fallen ill, and sadly, a staggering number have lost their lives. But these figures are more than just statistics. They represent mothers, fathers, siblings, friends, real people whose lives have been irrevocably changed by this tiny virus. But the impact of the coronavirus extends far beyond the human toll. Economies around the globe have been hit hard. Businesses have shuttered. Unemployment rates have soared, and financial markets have seen unprecedented volatility. The pandemic has laid bare the vulnerabilities in our global economic systems, with the poorest and most marginalized bearing the brunt of the fallout. Then there's the social disruption. The coronavirus has drastically altered the way we live our lives. Schools have been closed, travel has been limited, and social gatherings have become a thing of the past. Our day-to-day routines have been upended, and the simple pleasures we once enjoyed, like a handshake or a hug, are now fraught with risk. And let's not forget the psychological impact. The pandemic has taken a toll on our mental health, stirring up feelings of fear, anxiety, and isolation. It has tested our resilience and forced us to confront the fragility of life. The coronavirus pandemic is more than a health crisis. It's a social and economic crisis that has exposed deep-seated inequalities and forced us to reevaluate our priorities. It has challenged the resilience of our health systems and our ability to respond to global threats. But amidst the devastation, there's a glimmer of hope. The crisis has spurred unprecedented global cooperation, with scientists, healthcare professionals, and governments coming together to combat the virus. Undeniably, the coronavirus has reshaped our lives in unprecedented ways. But as we navigate this new reality, we're reminded of our shared humanity and our capacity for resilience. After all, we're in this together. But what exactly is this tiny yet powerful organism that has caused such havoc? A virus, at its core, is a small infectious agent. It's almost like a microscopic hijacker, unable to reproduce by itself. Instead, it invades the cells of living organisms, commandeering their biological machinery to replicate. It's a bit like a pirate taking over a ship, only on a much smaller and more complex scale. Now let's delve deeper. The coronavirus, known as SARS-CoV-2, is a type of virus that belongs to the family of coronaviruses. Its name, you might be wondering, comes from the crown-like spikes that protrude from its surface, resembling the sun's corona. But it's not its royal appearance that makes this virus potent. It's its ability to spread and infect. This particular virus targets cells in the lungs, making it a respiratory virus. Once inside, it begins to replicate, creating more and more of itself. It's this process that leads to the symptoms we associate with the disease known as COVID-19. These can range from mild symptoms like a cough and fever to severe symptoms such as shortness of breath and pneumonia. But what makes the coronavirus particularly potent is how effectively it spreads. It travels through tiny droplets when an infected person coughs, sneezes, or talks. It's a stealthy operator, with some people showing no symptoms at all, unknowingly spreading the virus far and wide. So, why are we so concerned about this virus? It's simple. It's a new virus, which means our bodies haven't encountered it before, and we don't have the necessary antibodies to fight it off. This, together with its high transmission rate, has led to the global pandemic we're currently facing. It's important to remember, though, while this virus is potent, it's not invincible. Science is on our side, and every day we're learning more about how to combat it. From understanding its structure to developing vaccines, our knowledge is our weapon. Understanding the nature of the virus is the first step in fighting it. Now, you may be wondering, how does this virus spread so quickly and widely? Well, let's demystify that. The primary way the virus spreads is through respiratory droplets. Imagine this: when someone with the virus coughs, sneezes, or even talks, they release tiny droplets into the air. These droplets can land in the mouths or noses of people nearby, or possibly be inhaled into the lungs. This is why close contact with an infected person is a significant risk factor. Now, you might be thinking, what exactly is close contact? In general, it's being within about 6 feet of an infected person for a total of 15 minutes or more over a 24-hour period. But remember, this virus is a tricky one. It doesn't play by hard and fast rules. Even brief interactions can potentially lead to transmission. Here's another crucial piece of the puzzle: asymptomatic carriers. These are individuals who carry the virus but show no symptoms. They may feel perfectly healthy, but they can still spread the virus to others. This is particularly concerning because it makes the virus harder to track and contain. Now let's debunk some common misconceptions. Despite popular belief, the virus doesn't spread through 5G networks, it's not transmitted by mosquitoes, and it doesn't just affect older people. Anyone at any age can contract and spread the virus. And what about surfaces? You may have heard differing opinions on this. While it's true that the virus can survive on surfaces for a short time, the risk of catching the virus from touching a surface is relatively low compared to direct person-to-person contact. Still, it's a good idea to clean and disinfect frequently touched objects and surfaces regularly. So there you have it. The virus spreads primarily through respiratory droplets, close contact, and asymptomatic carriers. Misinformation can create unnecessary fear, so it's crucial to understand the facts. Knowing how the virus spreads can help us take effective measures to prevent its spread. So, how can we protect ourselves and our loved ones from this invisible enemy? It starts with some basic but powerful practices. Hand hygiene is paramount. Wash your hands frequently and thoroughly with soap and water for at least 20 seconds. When soap and water aren't available, use a hand sanitizer that contains at least 60% alcohol. Next, wearing masks. Masks act as a simple barrier to help prevent respiratory droplets from traveling into the air and onto other people. Wear them whenever you're in public settings where social distancing measures are difficult to maintain. Speaking of social distancing, keep at least 6 feet of distance from others whenever possible. This reduces your chances of coming into contact with the virus. Finally, get vaccinated. Vaccines have proven to be a game changer in our battle against this virus, providing a high level of protection and significantly reducing severe outcomes. Armed with the right knowledge and practices, we can all play a part in curbing the spread of the virus. In these past few minutes, we've taken a deep dive into the world of the coronavirus. We've explored how this virus has shaped our global community, impacting lives and economies on an unprecedented scale. We've scrutinized the science behind this invisible enemy, understanding its nature and behavior. This knowledge is key in comprehending how the virus spreads, from person-to-person interactions to surface contact and airborne transmission. We also focused on the most crucial aspect: prevention and protection. Simple measures such as maintaining good hygiene, wearing masks, and practicing social distancing can significantly reduce the risk of infection. We must remember that these steps not only protect us, but also safeguard those around us, particularly the most vulnerable. Knowledge is our most potent weapon in this fight against the coronavirus. While the coronavirus has indeed changed our world, knowledge, understanding, and collective action can help us navigate this challenging time.